Health Director Dr. Raynard Washington tells me the goal is to not have to bring back any restrictions or recommend any safety precautions. But it all depends on future variants and how we utilize the tools proven to keep COVID transmission low. The repercussions of spring break, holiday gatherings, and loosened restrictions are becoming clear in COVID data.
It's a very slow upward trend, unlike the kind of acceleration we saw with the initial Omicron strain back in December.
The latest data available shows in the last 2 weeks of April, there were about 2,700 new COVID cases reported in Mecklenburg County, a 93% increase from the previous 2 weeks. All of wastewater monitoring sites in the county detected the virus in more than 40% of the samples tested. ER visits for COVID-like symptoms went up 70% from the previous 2 weeks, and 10% of those visits led to a hospital admission.
We're watching the situation very closely, and specifically want to just make sure that our more vulnerable residents who are either immunocompromised or have underlying health conditions have the most up-to-date information available to them as they are out and about in the community.
Health Director Dr. Raynard Washington says restrictions would likely be seriously considered if the county moved into the CDC's medium level.
COVID pneumonia.
That's based on the number of new cases and hospital admissions for every 100,000 people in a week.
A little under halfway relative to the case count. So if we got over 200, that would trigger us into the medium automatically. And if we got to more than 10 new admissions per 100,000, then that would trigger us to go to the medium as well. So those two trigger points are pretty far off right now relative to getting us out of the low to the medium.
Right now, the majority of tests sequenced in the county are coming back as the BA2 subvariant. Dr. Washington says BA4 and BA5 have not been detected yet, but he cautions that doesn't mean that they're not here. At the Mecklenburg County Health Department, Chloe Leschner, WCNC Charlotte.